Welcome to the third day of webinar, Synergy, Parent and SLP. Hope yesterday's talk was informative and gave you ideas on how to keep your child engaged. Today, the final talk is on feeding problems in children, followed by question and answer session. I'm privileged to introduce Ms. Deborah Athaide. She has 8 years of experience in the field of speech-language pathology. Her area of interest are child language disorders, child feeding and swallowing disorders. She is currently working as assistant professor in Department of Speech Language Studies. Over to you, ma'am.
Thank you, Pragna. So the topic that I am going to be talking about are feeding problems in children. And before I start, I'd just like to clarify what I mean by feeding. So throughout this talk, you'll be hearing the word feeding, feeding. So this doesn't just mean a parent feeding their child. It also includes the child feeding themselves. It also includes the way the child is chewing, swallowing, biting, all of those skills. So you may use it synonymously with eating. Okay, so when I say feeding, that's what it means. Now, I've just noted down some of the objectives of the talk. So I hope that at the end of this presentation, everyone who's listening will have some idea as to why feeding is important, who might have a feeding problem, and what a feeding problem looks like in a child. So what are the warning signs to know whether your child has a feeding problem, and some tips on how to promote good feeding at home. So first, I'd like you all to ask yourself this question. Why do you think that feeding is important? Why is it essential for us? You can type in the chat box or just think about it. I can't see the chat anyway. Yeah, so I'm sure that if you think about this, all of you will say that feeding is important for survival, because if we don't eat, we won't have nutrition, we won't survive. And that's true. That's the primary reason why feeding is important, is for us to survive. But now I want you to think about all the times when you eat. So when I say the times when you eat, I don't mean morning, afternoon eating, evening. I mean, what occasions do you eat, during which you eat? So when would you have a meal? Okay, so there are some things in the chat. Can my slide still be seen?
Yes, ma'am, but we can see the sidelines.
Yeah, okay, I can't see the chat then. Okay. So if you think about when you eat, there are so many occasions on when we may eat. We need to meet a friend, we'll catch up over coffee or over a meal. You have to celebrate a promotion, you have to celebrate a new job, you have to celebrate a new birth in the family. There'll always be some eating involved, whether it's a party or whether it's pedas, whatever it may be. If you want to celebrate your birthday, there's always food. If someone comes over to your house to visit, it would be an insult if you didn't offer them something to eat. So in our entire lives, feeding is always interrelated with socialization. It's interrelated with interaction. So feeding is not just putting something in your stomach so that you don't die. It is, there's so much more happening during that time of feeding, so much of interaction, so much of socialization. So just like this is what happens in our lives as adults, even for a child, this situation of feeding or the moments of feeding are more than just putting food into the child. There is so much of interaction and bonding happening there. This begins from the bond that a child develops with his mother during breastfeeding. It continues with whoever feeds the child as the child grows up, whether it's the mother or the father or the grandmother or whoever it is. Okay. This continues through the child's life as they eat with their family, as they eat with their friends. So we see that as a child is developing, these moments of feeding are very important moments in the child's life. So feeding becomes an important aspect of a child's development. So when we look at this skill of feeding, there's so much involved in it. So in order to have intact feeding, you need to have good motor skills, good sensory skills, good family dynamics, not too significant medical problems, and you need to have appropriate behavior. So a problem in any of these domains can affect feeding in a child. So now that we know that, okay, why feeding is important and that so many things are involved in making feeding good, we can assume that any problem that can affect development of any of these domains can result in a feeding problem. So now we will look at a few conditions in which feeding may be affected. So the first thing we're looking at is any problems that occurred early in childhood. So when the child is just born, was the child premature? Was the weight of the child okay? Did the child have to be tube fed? Any of these conditions can put the child at a greater risk of having a feeding problem later on in their life. Another condition in which we see significant amount of feeding problems in children who have cerebral palsy. So cerebral palsy is a condition, a neurological condition that affects movement in children. Any problems with muscle weakness, any head and neck problems, all of these can also result in problems in feeding. Many syndromes can be associated with feeding problems. A very common syndrome that you may have heard of is Down syndrome. So children with Down syndrome do have a tendency to have more feeding problems than usual. Children who have structural anomalies, children who have any kind of craniofacial anomalies, that means problems with their lips, mouth, palate, these can result obviously in feeding problems. Now, all of the conditions that we looked at just now, it seems in these conditions that it's very logical that there may be a feeding problem in these children. Yes, if you have a structure in your structural defect in your mouth, you can have a problem with feeding. If you have a neurological condition that doesn't help you move your body, it may not help you move your mouth to eat. But there are also conditions in which it's not so obvious that there is a feeding problem. Okay, for example, in children who have autism spectrum disorder, structurally, everything looks normal in that child. Their lips, tongue, everything looks okay and it moves okay, but still these children can have feeding problems. They can have feeding problems related to sensory issues that they might have. Children who have behavioral problems are also at a higher risk for having feeding problems. Children with language impairment also have a greater incidence of feeding problems than in children who do not have language impairment. And even children who develop typically, when I say typically, they're following the normal pattern of development in every other way, in their language skills, in their motor skills, in their cognitive skills, whatever it may be, they too can have feeding problems. Up to 25%, 25 to 45% of these children can actually have feeding problems, even if they are developing typically in all other ways. Okay? So now that we know that a lot of children can have feeding problems, what does a feeding problem look like? We're going to look now a little bit into what are the signs of a child having a feeding problem. How do you know whether your child might have a feeding problem or not? So first, if your child tends to cry, to be irritable, or to not be happy before meal times, specifically related to meal times, that can be a sign that something is up with feeding in that child. If your child refuses to eat, so whenever food is put in front of your child, if your child either closes his mouth, turns away, makes some kind of a facial grimace, spreads his fingers out like this, showing obvious signs that he's not happy. And a feeding time should be a happy time. So a child who's showing all these kind of behaviors before feeding, even if he does eat his meal, and even if he is healthy, that's still something that needs to be addressed. Some children may get upset when their face is touched before they eat. So they may have issues with sensation, so they don't like things touching their face. So whether it's food or somebody touching them, whenever it's related with feeding. Some children may just be listless. So they don't show that initiation to want to go and take food on their own or want to eat on their own. You put the food in their mouth, it's okay. You don't put the food in their mouth, it's okay. They don't really show a reaction. So that's also not a good sign. Some children may gag when food is offered to them. So a gag, all of us have gagged at different times. So we usually gag if like you put your toothbrush in too far, or you're at the dentist and the dentist touches too far back in your mouth, because this is something that's protective, and it's to protect us from something bad happening. And it's very unpleasant. So a child who's gagging while he's eating, that's not normal. That shouldn't happen, because eating shouldn't be something that's unpleasant and that makes you gag. Some children may have very restricted diets. That means that they may only eat particular things. So they may only eat rice if it's with some kind of watery curry. They may only eat a banana if it is, a ripe banana that is smashed to some degree, or whatever. They may not be able to eat a large number of types of food. Some children may have excessive drooling. So that is saliva coming out of the mouth continuously or during the time of feeding. So that also tells us that something's up in the oral cavity. Children may have problems with chewing, biting, sucking. So they may not be able to bite if the food is too hard. They may not be able to chew if the food is too hard. Or they may just put food in the mouth and swallow it without chewing, or just put food in the mouth, chew it a bit and then swallow it without actually chewing it enough. So this can indicate that there's not enough strength in their oral muscles, that they may have even sensory problems that are preventing them from doing this. Some children may have food that spills out of their mouth while they're chewing. So their mouth may be open. They may not be able to control what's in their mouth. Other children may have problems feeding themselves. So even if a child is fine when you are feeding the child, children should start feeding themselves with appropriate utensils at the appropriate time. So even if a child developmentally is not using the correct utensil to feed himself, is not able to do that, that also can indicate that there is a feeding problem. Some children may overstuff their mouth and just hold food in their mouth and need constant reminders to swallow. Or they may eat food, take small bits and keep putting it in their mouth, and later on you may see food remains inside their mouth even when you think they have swallowed, but there's still food stuck inside their cheeks. That also can indicate that there are some problems. Some children may have food coming out of their nose after they have eaten. So they have eaten, they've swallowed, and then it comes out of their nose. Some children may vomit after they have eaten, and others may cough and choke during meal times. So all of us have experienced a few moments of coughing while we are eating, right? When we say it goes down the wrong way, it goes down the wrong pipe. But if this happens frequently, that's something that's a concern. If it happens once in a while, that's okay. The cough is there to protect us. But if it happens frequently, that's a cause of concern. Okay, so if you have now listened to these problems and have this thought in your mind that you may have a concern because maybe your child shows a few of these problems, I'm going to now put a list of questions that I want you to ask yourself and answer it for your child to know whether there may be a feeding problem or not. Because the questions that I'm going to put now are the important questions, or like the red flags, okay? So look at the question and think about whether your child shows that condition or not. All right, so these are some warning signs to help you to know whether your child may have a feeding problem. The first question, are mealtimes stressful to a child or a parent? So a typical meal should not be stressful for either the mother or whoever's feeding the child, or for the child. It should not be a stressful time at all. If you look at this picture here, it looks like the mother is pleading with the child to eat. It shows that the child is clearly not happy, is clearly views this situation as something that's aversive, right? And like I said, feeding is such an important time for interaction to happen and other language skills to develop. And if it's going to be a stressful time, you're not going to get anything out of that except for food going in. Okay, so feeding time should not be stressful for either parent or child. How long does a meal take? So a typical meal, like an average size meal, should not take more than 30 minutes on a regular basis. If you are taking 40 minutes to 1 hour to feed your child one meal, that's a sign that something may be wrong over there. Because even though I said that, yeah, feeding is a time of interaction and so much bonding can happen over feeding, that doesn't mean that all of the bonding and everything has to happen during feeding times. So a child who is spending majority of his day feeding, like 1 hour in the morning, 1 hour in the afternoon, 1 hour in the night, is missing out on so many other things that children need to be doing, running about, playing, studying, whatever it may be. So that taking too much time on meals is also cutting away from other important time in a child's life. This is an important question. Is your child gaining weight adequately, and does your child eat enough? So even though this table looks at age and weight, remember that this also depends on how tall your child is and how healthy your child is, right? So this is just an average of what a 4-year-old child should weigh, what a 3-year-old child should weigh. So yeah. So if your child is not gaining weight or is losing weight, that can be a sign that there is something wrong with the child's feeding. Next, does your child let you know when he's hungry and when he's full? So typically, a child, when you're feeding a child, you would know when the child is hungry. He would indicate in some way, look at the food, point towards the food. If he can speak, maybe ask for the food, okay? And when you start feeding the child will be eager to eat and ready to eat the bites that you're putting inside his mouth. But after some time, this slows down and then the child closes his mouth and turns away. So he will tell you that, okay, I'm done. So this is how it should typically look. You should be able to follow what your child is telling you about their body and about the food that they need. But if you have a child who doesn't indicate when he's hungry, if you feed him, he eats. If you don't feed him, he doesn't eat. And it doesn't really matter to him. That is also a cause of concern. The next question, do you have to do anything special to feed your child? So when I say special, I mean, do you have to mash your food? Do you have to mix it with water? Do you have to take only particular types of food to feed your child? He cannot eat what the rest of the family is eating. Okay, do you have to do something special just to make sure that your child eats? Because even young children very early start eating whatever's being had in the house. Okay, maybe if it's a piece of meat, it may need to be softened and then given to them. But otherwise, most of the food that is eaten by an adult can be eaten by a child. So smashing a child's food after the child has, developed teeth is something that is a cause of concern. And finally, does your child show any signs of respiratory distress related to feeding? So respiratory distress is problems related to breathing, okay? So do you see changes in your child's breathing pattern after eating? Does your child get frequent respiratory illnesses like pneumonia, okay? Do you observe that there's a change in the child's voice after he has eaten something? So does it become gurgly, or do you feel like, there's some water over his in his throat? So this also can indicate that something is wrong with the child's swallowing. Okay, so if you have answered any of these questions, either yes or no, I mean, in the sense, if it was something that I said that it should not be there, I would recommend that you speak to a speech language pathologist as soon as possible, okay, so that your feeding concerns can be considered. So a speech language pathologist is part of a team of professionals who helps to work with children who have these feeding concerns. And even if you do you're not sure whether your child has a feeding problem, or you think that, it may pass away if I wait long enough. I would urge you to check as soon as possible and not wait, because just like you have any condition, you want to go to a dentist would want you to come when your cavity is small, not when your cavity is big. If someone is diagnosed with cancer, they'd want the cancer to be diagnosed when it's in stage 1, not when it's in stage 4. So just like for any condition, you would want to identify it early and treat it early. The same it is for it's the same for a child who has a feeding problem. You would want to identify that feeding problem as early as possible so that it can be treated as early as possible. Okay, now I'd just like to leave you with some tips for how you can promote good feeding at home. Okay, these are general tips. It doesn't matter if your child has a feeding problem or doesn't have a feeding problem. They are still tips that everyone can use. The first thing is, do not force feed your child. Children will tell us when they want to eat. Children should, when I say tell, it means indicate in any way, when they want to eat, when they are full. If you force feed your child, it's like being penny wise and pound foolish. So it's like feeding your child today, you get the meal down, but this is going to, in fact, prevent later meals from going down easily if your child develops negative experiences with eating food. So don't force feed your child. Follow your child's hunger cues. Look for, if your child is looking at food, stretching out for food, putting his tongue out at food, showing that he wants food, and follow that. Don't just feed your child when you think, okay, now it's time for him to eat. Now is the time that I need to feed him. Let him develop a way of showing you that he's hungry. This doesn't mean starve your child till he's crying. It just means look for cues that your child is giving you. Encourage self-feeding in your child as early as possible, even if it is messy. Okay, because children, just like if you're learning how to walk, you have to fall down hundreds of times. You're learning how to ride a cycle, you have to fall down many times. So if you have to learn how to eat, you have to make a mess many times. And this, what we see as mess, okay, like food all over the mouth, food all over the body, food all over the floor, is actually very good sensory stimulation for the child. It's making the child get all of those experiences. So the child can experience everything all over his face, over his body before he puts it in his mouth. And the motor development that the child needs, that practice of, picking up a spoon, picking up his food, putting it into his mouth, has to develop. It's not going to be perfect from the beginning. Nowadays, if it can happen that, the person who's feeding the child may be busy. So because you're busy, it's easier to just, feed that child and not let him eat by himself, because after that, you don't have to clean up the mess if you have fed him. If you give him to eat by himself anyway, you don't know how much food is going in. You have to feed him and you have to clean up the mess. So that may sometimes prevent parents from allowing their children to feed themselves at a young age. Another thing that prevents parents is, there's sometimes this connection that I'm a good mother if my child is clean, my floor is clean, my table is clean, my house is clean. So, this thing of having to have mess around means I'm a bad mother, which is not true. So, yeah, so that can prevent parents from allowing their children to self-feed. Another thing that sometimes prevents parents from letting children eat is that they want to know exactly how much food goes into the child's body. So if you're feeding from your bowl, you know that everything that was in your bowl went into the child. But if the child is feeding by himself, half is falling out, you can't monitor how much food is given to your child. Okay, so that's another thing that prevents parents, because you don't know how much food is going into your child. So I would still encourage you to let your child eat by himself, make a mess, and you put bites of food in between, so that the nutrition is going in, but the child is still developing all of those skills. Finally, okay, not finally, but yeah, try different types of food and be patient. So when you want to introduce new food to a child, do it slowly. Put a little bit of the new food with a lot of the old food that the child usually eats, okay? And don't force feed it to the child. The child may just lick it, may just touch it, that's fine. If the child refuses it completely, that's also fine. Introduce it again after a couple of weeks and be patient with food. All of us can have an aversion when there's something new put in front of us, some kind of weird dish that we've never eaten before. Okay, so for children, that's normal. So we need to be patient with it. And remember to see that you're giving children food from all of the food groups. So you're giving protein, you're giving carbohydrates, you're giving vitamins. All right, so just make sure that your child is eating a variety of food, but introduce things slowly and at the child's pace. And finally, this is what I want to leave you all with, that feeding time is fun family time. So even if your child does have a feeding problem, you may have to feed your child separately because you can't feed him with everyone else. Even if you do feed him separately, keep him at the table when everyone else is eating. Give him his own little bit of food to make a mess with, okay? And involve the entire family in feeding. Feeding is not something that's just for survival. Feeding is a time when everyone bonds, when everyone interacts. So remember that feeding should be fun and feeding should be family time. No child should hate mealtime, and no parent should also hate mealtime. Okay, so this is what I would want to leave all of you with. Thank you.